and Care Source. Let's join the host of Health Week, Pam Cook.
And good morning, everyone. Welcome to Health Week Day 2. And today we are broadcasting live from the Starr County Health Department. We are live on Facebook, so you can check us out there if you want to as well. Love for you to do that. And I always say that health departments across the country, including the Starr County Health Department, came into prominence in that terrible time of COVID, right? Everybody knew about the health department at that time, but boy, health departments are so much more than dealing with that COVID pandemic, and I think that's probably one of the reasons we're here, so we can share with you everything there is to know about the Starr County Health Department. And we have with us right now the Health Commissioner, Kirk Norris. How are you, sir?
Good morning. I'm doing well, thank you.
And also Communications Specialist, Walt Dorshak. Hi.
Good morning. How are you?
I'm doing great. Glad to be here. So, okay, first of all, Kirk, introduce yourself a little bit to our listeners so they can kind of get an idea, because you've been with the health department for quite a while, right?
Yes. So my name's Kirk Norris. I've been health commissioner since 2012, but I've been with the department since January of 1995. So it has been 30 plus years. This is my second home, and this is my second family here.
And tell us a little bit about your career as well.
Sure. So I've been in public health now for about 2.5 years, going on 3 later this year. And so just my role as a communication specialist is to just tell about what we do, and that's kind of our goal here today, is to share more information about what public health really does and all our services.
All right, great. So, Kirk, we'll start with you. Talk a little bit about public health and why we're here today.
Well, so one of our strategic priorities within our strategic plan is to, you can believe it or not, is to strengthen our public image. You brought up that nasty word a little while ago, so to strengthen our public image. So what we want to make sure is that everyone knows and understands what we do and what our department provides to our community. We do serve 17 townships, 12 villages, and the cities of Canal Fulton, North Canton, and Louisville. And the health department, we focus on prevention and community wellness, and as well as disaster response, and we try to assure quality and accessibility to our health services.
And when people are looking to the health department, what do you see them usually thinking of first, besides that other word?
Yeah, I'm sure that we talk about this all the time, that whenever people normally think of us as shots or vaccinations, and food service inspections. That's mainly what people, when they call in, think that we do.
All right, so let's talk about the services. What are some of the things that the health department does?
Yeah, so we have 3 distinct service areas. They all are separate, but we also kind of work together in separate ways. So we have our administrative and support services. We have our vital records department, which is up front with our clerks. They're the first people that you see when you walk in our doors. They can help you get a birth and death certificate, among other things. We have a team of health educators that work across different areas, that they work in areas such as overdose education. That we work to distribute naloxone or Narcan, which is just a drug that reverses the effects of an overdose. We also have some team of health educators that work on a car seat program. You'll hear a little bit from Logan later today. And what they do is they help keep your child safe when you're riding in a car. In addition to that, I think Kirk mentioned that we also do some emergency preparedness. We help your family if there's, for example, if you have a power outage or if there's a severe storm. We try to provide some education on what things to do in those certain areas. And then we also provide some access to reports. You can find those on starkhealth.org, our website. It's just about different parts of our community health and what you might find on there. And then we also have our nursing services. We have our immunizations that Kirk talked about. We provide different times and days that kind of meet your schedule. You'll hear, I believe, next segment from Aubrey, more about that. We have our Take Care down there, reproductive health and wellness program. They provide different services such as annual exams. We also provide walk-in STD testing to help those in need of that service. We also provide walk-in tuberculosis testing. On Tuesdays, we provide our complex medical help program, which helps families with critical health care needs for their children. We connect them to the services and providers that they need. We have our Cribs for Kids program, which provides cribs for families who need them and for those who qualify. We investigate communicable disease. You'll hear from someone later about that today. We also have some community health workers that they go out into the community, provide monitoring resources for families. And then we have some breastfeeding support for mothers who need that service. We are in schools. We're in 4 different public school districts who our school nurses are in there. And then we also have 1 private school that our nurses go into. And then we also have our WIC program, our Women, Infants, and Children's program. It provides nutritional support for families in need of that. Then we have our environmental health services. Those are the services that are really all around you, but you really might not see that. We help test your water well for harmful bacteria. We also will inspect your septic system, to make sure it's installed properly. Then we'll also hear from Courtney Litter today, who will, part of her job is to go around and inspect campgrounds and as well as swimming pools, and we also inspect food establishments, and you'll hear from someone who works in that area as well. So there's really so much that we do that, again, that people really may not see, but it's just part of what public health does.
I was just going to say, see, we told you.
Yeah.
Because there's a lot.
Yeah.
And it also brought to mind, like, the incident in East Palestine. They took care of a lot, right, Kirk? Is that...
Yes, so we did assist.
Okay.
I believe we sent 3 or 4 inspectors to help Columbiana County Health Department with their testing and mitigation efforts. So, and that's just what we're about. Not only the Starr County Health Department, but all health departments within the state. They all come together at times of need to assist one another. So that's nothing from what we're not used to.
What do you think is the most surprising thing to people that they say, the health department handles that? Is there anything out there that seems surprising to people?
You know, I guess a lot of people, when they discard their waste into their trash cans, they don't understand that Starr County we actually regulate 2 of the largest landfills in the state of Ohio. We're lucky enough to have 2 of the largest. That's a joke. And I don't think people understand that once they throw something away, where that goes and how much regulation it takes for us to be involved and make sure that from cradle to grave it's taken care of properly. That's one thing I would say.
And how many people do you serve, would you say?
I believe right now it's right around 250,000.
Wow, 250,000. That's a big job. That's a big job. And that's why you have so many folks that are on your team, correct?
Correct. We have around 81 full-time and part-time and seasonal employees on staff right now.
Wow. And when it gets to the summertime, I mean, do things change by season of all the different things that you do?
Yeah. Just as I mentioned, a big thing for us right now is campgrounds and swimming pools, just because that's something that obviously swimming pools have just opened. We've had so much rain in this area. It's hard to go swimming at times, but that's something we do. We also, one thing I did mention with our environmental health services is we control the mosquito population. You'll hear a little bit more from Phil there
From
today.
Phil, yes. I get emails from Phil all the time,
Yeah.
and I'm so excited I get to see him in person today.
Yeah.
He is good at what he does.
Yes, he is. Yes, he is. So as we have people thinking, oh my gosh, that's where I go for that, they can come out here, correct, to your location if they need help, or is it better to go online or call, or what would be the best?
They can do anything. They can call, they can email, they can come through the doors. We're available. We're actually on call as well 24/7 through a hotline, through a call center. But whatever's if accessibility is an issue, give us a call or shoot us an email.
And you're located on Whipple Avenue, Park Center.
Yes.
Folks, it's so easy to find, just if you're on Portage, you either hang a left or a right onto Whipple towards Apple Grove, and you'll find it right away.
Yes.
Stop out and say hello. All right, we're going to take our first break. And when we come back, we are going to talk about back-to-school immunizations, probably one of the first things people think about when they think of the health department. And we will do that here coming up in just a few. This is Health Week on 1480 WHBC.
Call 1-866-SKY-RIZZY to learn more.
This is Health Week on 1480 WHBC. Now back to your host, Pam Cook.
And welcome back, everyone. It is Health Week. This is day 2, and we are broadcasting from the Starr County Health Department. And as you heard in our first segment, so many different things that the health department handles. And we're going to start off now with back-to-school immunizations and maybe immunizations in general. We have Aubrey Neuenschwander. Yes, unit manager. And so tell me a little bit about yourself first so folks can kind of get an idea.
So I have been with the health department since November of 2019, and I took over the unit manager role in 2021.
All right, very good. So immunizations, boy, a big topic these days, and there are families out there who are getting their kids immunized, right?
Absolutely there are. Right now, it's time to get ready for going back to school, and so we have a lot of clinic availability right now for people to get up to date before return to school back in August.
All right, so what's required for them to go back to school?
So there's different requirements depending on your age and the grade that you're going into. New vaccines are required for kindergarten students, 7th grade, and 12th grade students. And there's quite a few different vaccines that are required by Ohio law. They can include DTaP or Tdap, depending on your age, which protects against tetanus, diphtheria, and pertussis. The polio vaccine is one that's required, hepatitis B, MMR, which protects against measles, mumps, and rubella, meningococcal, and varicella, which protects against chickenpox.
Wow. So, and I remember all of those as a kid, but it's different now, though. There's a lot out there. So, parents, how do they go about doing this? Setting up a schedule.
Yeah, so we do all of our vaccine clinics by appointments, so they can call us at the health department. Our phone number is 330-493-9914, and we have vaccine clinics available every single week. We offer them on Mondays, Tuesdays, and Fridays at a variety of times. And for our kids, we have both during the day, and we also have evening appointments available for children as well.
Now, and I said to you off the air, I remember when my sons both went to college, they were required to have immunization, which I think it was hepatitis. Is that right?
That's likely one that was required
Okay.
for college students.
Yeah.
Another one right now that college students are recommended to get are the meningococcal vaccines if they have not had them during high school as well.
And what is the meningococcal vaccine?
There's 2 different meningococcal vaccines that protect against different types of meningitis. The one that's required for high school students is meningococcal A, C, W, and Y. It protects against 4 different strains of meningitis. And then one that's recommended for college students to get is meningitis B. And so we are seeing people start to make their appointments right now for these clinics as well.
And what else are you seeing when it comes to the clinics? Adults, are they coming for the measles vaccine?
Absolutely. We've been giving a lot of the MMR vaccines. It's recommended that all individuals have 2 doses of MMR. And so our adult vaccine clinics have been quite busy over the last few months getting the MMR vaccine as well as our typical flu vaccines, RSV vaccines, all of the recommended ones for adults as well.
And do these cost anything? The vaccines go through insurance? How does that work?
Yeah, so we're able to see individuals who are birthed through their entire lifespan. We do offer most private insurances that we can run through those. We accept Medicaid insurances, and we're able to see those that have no insurance as well. We do have a sliding fee scale for our administration fee, and the state helps provide vaccines for those who are uninsured.
And when we talk about MMR and the measles vaccine, you had that as a kid. I think that most of us did, or we hope so. But how do you know that you need to have it as an adult? Should you get a booster? How does that work?
So if you had both doses of your MMR vaccine, it's not recommended to get a booster for the majority of folks in regards to a measles outbreak. There are different recommendations for the mumps outbreaks that could occur. Then they would recommend a third dose. People can go to their primary care doctor to look for immunization records or pediatricians. If they recently graduated high school in the last 10 years, the high school should also have their vaccine record on hand. There is a state immunization database that your provider may have used. It's not a requirement in Ohio for every doctor to enter vaccine records there. So you can always reach out to our health department by email or by phone, and we can check and see if there is a record on hand. I know one question we get a lot, especially from our older population, is how do I get my vaccine record? My doctor isn't here anymore, their office closed, and they can check out with the Stark County Medical Society to see if they can obtain a record that way.
Okay, that's good to know. And also I hear people talk about needing to get vaccines when they travel, especially if they're obviously going out of the country. What is that about?
Yes, so depending on where you're traveling, that is something that we're able to help with. There are certain vaccines that are recommended based off of the diseases where you're traveling to, what is prevalent there. So we're able to do some of those vaccines like hepatitis A and B, but if there's something specific like yellow fever, typhoid, there are other places to obtain those. And typically we recommend going to Canton City Public Health or Summit County Public Health because they offer travel vaccines specific to those areas.
Okay, so folks listening right now, if they want more information, how can they contact you, or what's the best way to do that?
It's best to call us. We have people available all the time to answer the phone. And again, our phone number is 330-493-9914.
All right, very good. Well, thank you so much. A lot of great information about immunizations, and if you have any questions, still make sure you give them a call here at the Stark County Health Department. We're going to talk about Stark County Health Mobile, suicide prevention, and much more coming up on day 2 of Health Week. We are at the Stark County Health Department, and this is 1480 WHBC.